Gentlemen, I want you to imagine this, waking up tomorrow morning feeling a renewed sense of vitality, experiencing that spontaneous firmness you may not have felt in years, naturally. No prescription medications, no mechanical devices, and certainly no risky procedures. Just a few minutes of guided, intentional stimulation using nothing more than your hands, reactivating your body's natural ability to produce strong, consistent erections. I'm Dr. Samra, a urologist with over a decade of clinical experience in men's health and sexual medicine. My mission is to help men regain control of their sexual function through methods that are safe, effective, and grounded in medical science. Today, I'm going to walk you through 3 scientifically validated pressure points located on and around the male pelvic region that, when stimulated correctly, can significantly improve your morning erections. These techniques enhance penile blood flow, relax critical muscle fibers, and stimulate key nerve pathways involved in arousal physiology. If you've noticed those automatic morning erections becoming less frequent or less firm as you've gotten older, you're not alone. And this information is for you. By the time we reach the end of this session, you'll have a complete understanding of where these points are, how to activate them safely, and how to make this a part of your daily wellness routine for sustained results. Let's begin with some foundational knowledge, understanding why this works. Erectile function is not simply mechanical. It is the result of an extraordinarily complex and elegant coordination between your nervous system, circulatory system, and musculature. Erections are initiated by neural activity, primarily parasympathetic responses, that originate either in the brain or from direct physical stimulation. These signals travel via spinal and peripheral nerve pathways to the smooth muscle cells lining the corpus cavernosum, the sponge-like structures within the shaft of the penis. When these smooth muscles relax, arterial inflow increases, causing the penile chambers to fill with blood. Simultaneously, venous outflow is restricted, resulting in engorgement and rigidity. However, as men age, we begin to experience changes in both vascular and neurological function. Arteries in the pelvic region may stiffen due to reduced elasticity and atherosclerotic changes, often accelerated by chronic inflammation, hypertension, and sedentary lifestyle. Moreover, nerve conduction speed declines with age, making the signal transmission from the brain to the body noticeably weaker and slower. This dual impact, diminished blood circulation and deteriorating nerve function, is a significant contributor to the decline in spontaneous morning erections seen in men over 50. The strategy I'm teaching you today, targeted pressure point stimulation, is effective because it directly engages the body's natural erectile reflexes. By applying moderate tactile stimulation to specific regions, we can activate key sensory and motor nerves that trigger penile response. These reflex pathways connect to both the pelvic nerve plexus and the spinal cord's sacral segments, the exact region where the erection generation command center resides. This stimulation initiates a cascade of physiological responses: relaxation of the smooth muscle in the penile arteries, widening of blood vessels, and enhanced responsivity of penile nerves. Some of these points also engage the pelvic floor muscles, the supportive muscular structure essential not only for initiating an erection, but also for maintaining it during intimacy. Engaging these areas frequently builds greater tone in these muscles and restores neuroplasticity, renewing your body's ability to achieve and maintain morning erections. Think of these interventions as physiological calibration, a way to reboot and enhance the communication between nerves, blood vessels, and muscles. When performed correctly and consistently, this method can improve penile sensitivity, enhance vascular flexibility, and retrain your body to respond as it once did, optimally and without external aids. Let's look at the first point, what I refer to clinically as the penile root convergence point. More casually, the base groove. This area is located precisely at the junction where the penile shaft connects to your lower abdomen, a key anchor point between superficial structures and deep pelvic musculature. To locate it, trace your fingers along the underside of the shaft, moving toward your pelvis. You'll detect a natural indentation or groove, a clear biomechanical transition zone. Beneath this subtle marker lies a convergence of major dorsal nerves and vascular branches responsible for feeding blood into the corpora cavernosa during erection. This is not simply soft tissue. It is a communications hub between your peripheral nervous system and your central erection centers. When stimulated correctly, this area can dramatically enhance both nerve conductivity and blood inflow. I instruct patients to use gentle, controlled circular massage on this point, no deeper than necessary, and always within the range of comfort. Place your thumb gently on the groove, providing stability with the fingers wrapped around the other side of the shaft. Begin slow circular motions with light to moderate pressure. You're activating nerve channels and increasing blood vessel responsiveness simultaneously. You may notice a sensation of subtle warmth or a tingling awareness. These are physiological markers of increased circulation and vasodilation. Over time, as the tissue becomes more receptive, the effects become much faster and more pronounced. I suggest this be done daily, ideally first thing in the morning when your sympathetic nervous system is less dominant and your body is naturally relaxed. A warm shower is also an excellent time, as the elevated tissue temperature enhances circulatory responsiveness. The second anatomical focus is one that is dramatically underutilized, the perineum, clinically referred to as the urogenital diaphragm. Located between the scrotum and anus, this pliable strip of muscle and fascia sits directly above the bulbospongiosus muscle, one of the most critical muscle groups in the erectile sequence. Why does this matter? Because this muscle plays a pivotal role in maintaining erection by restricting venous outflow, essentially acting like a muscular valve keeping blood inside the penis during stimulation. However, like any muscle, disuse leads to weakness. Age, inactivity, and poor posture can reduce its ability to perform, weakening erections in the process. Applying fingertip pressure and circular massage to the perineum reactivates this muscle reflexively. It's a form of neuromuscular reeducation. To do so, sit comfortably or lie back with your knees slightly apart. Use your index and middle fingers to apply steady, moderate pressure into the midpoint between the scrotum and anus. Move in slow circular motions and watch for feedback from your body. A sense of warmth, soft pulsation, or a tingling awareness means the muscle is waking up. Spend about 2 to 3 minutes on this area. Once comfortable, consider integrating gentle pelvic floor contractions, commonly known as Kegel exercises, immediately afterward to amplify long-term gains in muscle tone and erectile control. Now, our third and final point focuses on a unique anatomical landmark, the coronal ridge, the raised ring-like junction where the glans penis meets the shaft. This area is highly innervated and serves as a sensory signal amplifier for arousal. We're not pursuing high-pressure friction here. Our goal is to gently stimulate the underlying nerves to restore their firing capacity. To begin, gently position your thumb and forefinger on either side of the coronal ridge. Apply mild pressure, holding for 5 seconds, then release. Repeat this hold-release technique for about a minute. Follow this with light circular tracing over the entire circumference of the coronal ring using your fingertips, maintaining a firm but delicate pressure, enough to engage nerves but without overstimulating. When done properly, this promotes faster sensory transmission to the sacral erection centers. Long-term benefits from this technique include improved signal speed, increased penile sensitivity, and more spontaneous arousal responses, especially in the early morning. It is not about overstimulating the area. It's about retraining the nerves to recognize and respond consistently. Now, for optimal results, I recommend combining all 3 techniques into a seamless daily sequence. Start with the base groove for 90 seconds, then shift to the perineum for 2 full minutes, and finally dedicate another 2 minutes to the coronal ridge using both hold-release and circular touch strategies. This routine, when executed consistently, leads to improved pelvic blood flow, muscle reactivity, and nerve coordination, the triad of healthy erections. Many of my patients report noticeable changes within just 2 to 4 weeks of beginning this protocol. Increased morning fullness, longer duration, and an unexpected boost in overall energy and sexual confidence. To enhance the results, address other essential pillars of erectile health. Hydration is fundamental. Vascular volume is crucial for penile pressure. Build pelvic floor strength through daily Kegels. Prioritize anti-inflammatory vasodilating foods rich in nitric oxide precursors. Think leafy greens, beets, and healthy fats. When your nutrition, hydration, and muscular engagement all support this daily pressure point work, the changes become more than just functional. They become transformative. You're not just restoring erections, you're restoring a critical part of your health and identity. Gentlemen, let me be clear. Declining erectile function is not something you simply have to accept as part of aging. Your body still possesses the potential to perform. Sometimes all it needs is the right stimulus consistently applied. These techniques are safe, natural, and entirely within your control. No medications, no side effects, no invasive options required. Make this a part of your morning health ritual. Give your body the stimulation it deserves, and in doing so, rediscover the confidence, energy, and performance you once took for granted. Because remember, your sexual health is a mirror of your overall health, and when you invest here, every area of your well-being improves.